Hi. Okay, so we're in week 6 in healthcare delivery systems, and in this week we're going to talk about hospital outpatient and other outpatient services. Last week we visited about hospitals, and now this is just a continuation of that. These are the objectives for the course, or for this week. And so let's just start with outpatient care. Basically, last week you learned what inpatient was. Outpatient is anything that's not an inpatient. That's all it is to it. If you're not an inpatient, you're an outpatient. That means you're not hospitalized. So patients visit an outpatient facility for care, and outpatient can be anything from your doctor's office, from your doctor's primary care offices, to specialty offices, to single specialty or multi-specialty. Outpatient can include your dentist, diagnostic labs, urgent care, mental health centers, substance abuse treatment centers, outpatient surgery, physical therapy and occupational therapy centers, home health, and hospice. But before we get too much into that, we need to define primary care. And this is important because they like to write accreditation test questions on primary care. Primary care is the care provided by certain doctors. And a primary care medical specialty, a primary care provider, they do family medicine, general internal medicine, general pediatrics, and OB and gynecology. So primary care is not only done by doctors. Primary can be done by nurse practitioners and physician assistants. So when you go to a clinic, you may see a nurse practitioner, and you may see a physician's assistant, or you may see a medical doctor. Okay, but that's what they mean by a primary care provider. A primary care depends on the level of setting. Primary care is usually that first level of care. Then other levels are secondary care and tertiary care. And I want you to read your transcripts for those definitions because you need to know them for future reference, and I'm not going to go over it, okay? But primary care, what you need to remember is that entry point to the healthcare system. So it's ambulatory versus inpatient care. So primary care is the strategy for organizing the healthcare system as a whole. So it's a community-oriented care. There's more emphasis on that, less emphasis on hospital-based acute care medicine. Because face it, most people need primary care. You go in for your physical. You go in because you have a sore throat. You go in because you sprained your ankle. It's primary care. This is an example of the physician-patient-clinician relationship. So you have the clinician, the provider, and the patient, and then you have the extended care team, then you have your family and the community, and then you have the delivery system. It's all part of the primary care network. So primary care is a narrow view. That's the first time, your first encounter. And then it's also the ground floor of healthcare delivery. And then you get the broad view there. Why am I spending time on this? Because we have a shortage of primary care physicians, and it's the point of entry. And when you have a shortage, it limits people's access to care, and then you get overuse of other services. So here's the attributes of the 1978 Institute of Medicine, IOM, Institute of Medicine definition for primary care. Basically, they treat the patient and the family, the community, and the ecosystem. And that's their definition. There's another definition. Primary care means so that it's accessible. It's easy for patients to initiate an interaction with the healthcare provider, okay? And it provides healthcare services. Clinician is someone who uses that knowledge base and has authority to direct patient care. A patient is a person who interacts. And they usually have a partnership. Accountable care, primary care physicians and systems that operate are responsible to their patients. And then most of your healthcare needs are done by primary care. Okay, so now that you know that term, and I don't want to spend any more time on it, we get types of outpatient care. So let's get out of the hospital setting, okay? We'll get back to that. But one of the things in outpatient care is retail clinics, and this is new and emerging. You'll find these in malls or shopping centers. They're usually freestanding, located there. They're usually staffed by nurse practitioners for people with additional training. And you can walk in and just get care for a common and minor illness. Why do these pop up? Because it's a cost-effective alternative to going to an established primary care clinic. This is the big one, outpatient care, urgent care. With the emergency room and the overuse of emergencies and the high cost of emergency room use, they started to develop urgent care centers. And an urgent care can be part of a hospital system or it can be freestanding. But they're usually less expensive than an emergency room. And they're usually for things that don't need an emergency room. Like if someone comes in with strep throat, or someone comes in with the flu, or someone sprains their ankle. It's not trauma care, but it is care that needs to be delivered. Usually urgent care centers have a lab or x-ray facility on site so they can do some diagnostic testing. They may have a little bit more advanced diagnostic testing, but it's not intended for life-threatening emergencies. So in 1996, look at the number of ER visits. In 2014, it was 137.8 million, an increase of 14.8% in emergency room visits since 2006. The highest users of emergency rooms were infants under the age of 1 year, and the most common complaint in the emergency room is stomach pain. The number of visits in the emergency room for Medicaid increased 66.4%. Now think about it, 66.4% for Medicaid. Why? Because most people don't have a primary care physician, and the only place they know to go is the emergency room. Medicare increased 28%. But notice, in 8 years, private insurance visits to the emergency room decreased by 10%. Why? Health insurance companies want you to use an urgent care. They have come up with other alternatives that are less expensive than going to the emergency room. And the big thing is, most of your private health insurance plans, the deductibles have gotten so high that to go to an emergency room is quite costly. So people with health insurance will look for other alternatives prior to going to the emergency room. So it's all about who's funding and why. Now, why is the emergency room outpatient care? You're thinking, okay, the emergency room was part of a hospital. Yes, it is part of a hospital, but a hospital provides inpatient care and outpatient care, and an emergency room is outpatient care. So emergency rooms are intended to treat life-threatening illness, but 11% of all ambulatory medical care visits occur in the ER. Okay, so misuse is very high. Effects of crowding in the ER, you get delay in treatment of serious illnesses. So if you got people there who shouldn't be there, it delays treatments for other. Long waits, reduced promptness and quality of pain management, called hallway boarding of admitted patients if they can't get in, ambulance diversions, but it decreases productivity. Why so many ER? In one study in New York, the potentially unnecessary ER cases were seen between 9 a.m. and 5 p.m. during the day. But it's also, like I told you, part of the primary care crisis. So the reason why they go to the ER, they may not have a doctor. There may not be enough primary care clinicians. They can't get in to see their doctor, even if they have one. They may not have insurance, but if you walk into an emergency room, you're going to be seen whether you have insurance or not. And most people with chronic medical conditions seek their care from the ER. So reducing inappropriate ER visits is key. And hopefully one way to do it is patient education, medical home visits, which a lot of insurance is going to, telephone triage systems such as call a nurse, availability of after-hours care, enrollment in safety programs, and just simplify the process. Okay, other types of outpatient services. You got outpatient diagnostic labs. You go in, get a lab test done, it's freestanding, you pay for it. Freestanding labs for pathology, what they can do. They can do testing. And then this just tells you what pathology is. Freestanding radiology clinics. You know, radiology is the medicine that uses imaging to treat or diagnose diseases. A radiologist is a physician who specializes in that. So outpatient may be housed within a hospital or freestanding. Hospitals have a lot of outpatient radiology services because it is an area of the hospital that does produce income. And this is an example of radiology. Diagnostic radiology is used for the diagnosis. So you got CT scans, MRIs, PET scans, ultrasound, mammograms, bone density, nuclear medicine. All of these produce revenue. Services for radiology, interventional radiology, such as an angiography, where they actually go and look at the blood vessels to see how healthy they are. Teleradiology, you can review images remotely. I can have an image taken in a small town and it can be transferred to Mayo Clinic for review. And that's called a PAC system. Go back, I'll just skip that one. Ancillary services, slide before, but other services for outpatient hospice care. Hospice care is for people whose life expectancy is less than 6 months. They're terminally ill. Hospice care is palliative care. So in hospice, they don't treat the patient for a cure anymore. What they do is their goal is to make that patient comfortable. You can have a hospice institution that is freestanding. You can have it at home. It can be hospital-based, but they have a care team. Other outpatient ancillary services provided by a hospital can be physical therapy, occupational therapy, speech therapy, and care is provided by persons with that training. So this is really fast on hospital outpatient services. So read your transcripts, read your notes, but the primary thing is don't get confused on that. One of the things about hospital or outpatient is ambulatory surgery centers, and that gets a little confusing. An ambulatory surgery center is a place where you just go and have surgery and you go home, and it may not be affiliated with the hospital. So for example, maybe I want to have cataract surgery. I might go to a freestanding ambulatory care surgery center to have it done instead of a hospital. Why? They specialize. 2, they're less expensive. The issue is you don't see a lot of those in a rural community. They're more of an urban type setting where you have more competition for services. So in a lot of small areas, small hospitals, a lot of these outpatient services mentioned here are provided through a hospital system. So a hospital it is an inpatient setting, but they offer outpatient services, and those outpatient services is a source of revenue for them. So look in your big textbook, look at outpatient services, read a little bit, do your assignments for this week, and check out your transcript. Thanks and have a good week.